We can go ahead and get started. Our topic for this session will be NF1-associated neurofibromas and other tumors. And as Diana mentioned, I'm Stephen Rhodes. I'm a pediatric oncologist at Indiana University, and I take care of patients in our NF multidisciplinary program, where we see both children and adults with NF1, NF2, and schwannomatosis. And when I'm not in clinic taking care of patients, I do research in the laboratory on NF1-associated neurofibromas and malignant peripheral nerve sheath tumors, which we'll be discussing during today's session. We have, I think, 4 outstanding speakers with us today, who I'll introduce in further detail as the session unfolds. We have Dr. Amy Armstrong from Washington University in St. Louis, who will talk with us about plexiform neurofibromas. We have Dr. Aerong Kim from Children's National Medical Center in Washington, D.C., who will talk on malignant peripheral nerve sheath tumors in NF1. We have Dr. Lu Lei from the University of Texas Southwestern Medical Center, who's going to talk about cutaneous neurofibromas and their surgical management. And finally, we have Dr. Kavita Sarin from Stanford University, who's going to give us an update on, I think, some really exciting research to identify the contribution of personal genetics to the development of NF1-associated neurofibromas and other tumors. I think this is a really important study that you yourself could have the opportunity to participate in if you desired. And so we'll look forward to hearing from Dr. Sarin later in today's session as well. And so I'd like to start just by giving a very brief overview to help orient everyone to the topics that we'll be covering. And so today we'll be focused on NF1-associated tumors, primarily ones that occur throughout the peripheral nervous system. And so as Dr. Bornhorst covered in the introductory session, there are 3 types of neurofibromatosis. There's NF1, NF2, and schwannomatosis. And NF1 is the most common of these, affecting about 1 in 3,000 individuals worldwide. And so that's quite a lot of patients. That's about 100,000 individuals just in the United States alone. And this is a disease that's caused by genetic changes or mutations in the NF1 gene that interfere with a protein called RAS. Called neurofibromin, excuse me. And neurofibromin is a very important protein that regulates the activity of a signaling pathway called RAS, which controls how cells grow and develop in the body. And so when neurofibromin function is disrupted due to a genetic change like this, it causes cells throughout the body to grow and develop in an abnormal way. And this can cause a variety of symptoms or manifestations that we'll talk about in just a moment, including the development of tumors throughout both the central nervous system, the brain, as well as the peripheral nervous system throughout the body that we're going to talk more about in today's session. And so because the neurofibromin protein is important to every cell in the body, individuals with NF1 can have a wide variety of symptoms. And these can include things like the development of what we call cafe au lait macules, or coffee with cream skin spots, as shown here. It can have freckling in the armpit or groin. It can cause a deformation of the bones in the leg, in the face, or in the spine, what we call scoliosis. Learning challenges and difficulties with focus and attention, what we call ADHD, it can be a major issue that patients with NF1 face because of how NF1 affects the development of the brain. And so it can also cause the development of leash nodules, which are colored spots in the eye, gliomas, which are essentially benign, slow-growing tumors on the optic nerve, the nerve that controls vision in the back of the eye. And they can also occur throughout the brain. And finally, as we'll talk much more about today, NF1 can cause development of neurofibromas, which are benign growths that can occur either on or under the skin, as well as deeper inside the body along the nerves. And so neurofibromas are growths that occur on or under the skin, but also deeper inside the body along various nerves. And these are generally benign, slow-growing tumors, although in some instances, as we'll discuss, these tumors can become quite large. And neurofibromas arise from cells that myelinate or essentially insulate the nerves. If you think of the nerve as a wire, as shown here, and you think of the rubber coating around that wire as the insulation, the Schwann cells are like the insulation around the nerve. And so when neurofibromin function is disrupted in Schwann cells due to a genetic change in the NF1 gene, that causes these Schwann cells to grow and develop in an abnormal way that leads to the development of these tumors. And so there are several types of neurofibromas. Cutaneous neurofibromas are tumors that arise on or just beneath the skin surface. And they're the most common tumors in people with NF1 and affect greater than about 95% of adults. And they generally appear during adolescence and then can progress and become more numerous throughout life. And they can range from just a few scattered tumors to hundreds or even thousands across the body. And they can be associated with symptoms like pain, itching, and disfigurement. And cutaneous neurofibromas are frequently cited by patients as one of the most disturbing aspects of NF1 as a major negative regulator of quality of life. And so Dr. Lu Lei, who's a dermatologist at the University of Texas Southwestern Medical Center, is going to talk with us more about the clinical features of cutaneous neurofibroma, as well as some of the treatment options that can be considered for these. Plexiform neurofibromas are tumors that grow along multiple nerves, and these can be either close to the surface or deeper in the body. And in some instances, they can become quite large, as you can see here, growing on the neck, shoulder, and chest, and down the arm of this patient. And so after cutaneous neurofibromas, these are the second most common type of tumor in NF1, affecting about 50% of individuals. And so these tumors typically arise during childhood, but can grow throughout life. And they can be associated with pain, disfigurement, or be even debilitating or life-threatening due to compression of vital structures such as the spinal cord or the airway. And so Dr. Amy Armstrong from Washington University in St. Louis is going to talk more with us today about plexiform neurofibromas, how they can present, and what are some of the types of treatment options that can be considered for these tumors. And finally, malignant peripheral nerve sheath tumor, which is distinct from the other types of neurofibromas that we've discussed so far. And this is a much more aggressive form of soft tissue sarcoma. It's a type of malignant cancer that persons with NF1 are at risk to develop. And so these tumors can arise oftentimes within existing plexiform neurofibromas, not from cutaneous or subcutaneous neurofibromas, but it can arise from within existing plexiform neurofibromas that have acquired additional genetic changes or mutations. And so a major concern about these tumors is that, unlike neurofibromas, these can grow very rapidly and can spread to other parts of the body, as shown in the PET scan on this patient. And this is called metastasis. And when this happens, unfortunately, these are very, very difficult tumors to treat, and they can be incurable in many cases. And so one of the best things we can do is to try to catch these as early as possible so that we can surgically remove them while they remain localized before they spread elsewhere throughout the body. And so Dr. Aaron Kim, who is an MPNST expert, is with us today from Children's National Medical Center, and is going to talk with us about some of the signs and symptoms that you should look out for so that you can be proactive and talk with your doctor if there's a concern about MPNST. And additionally, what treatment options, including things like surgery, radiation, or even various clinical trials with chemotherapy that are available to treat these tumors. And so I also just want to point out that there are a number of other NF1-associated tumors that we won't cover in depth during today's session. These include optic pathway gliomas, which occur, as I mentioned earlier, on the nerve that controls vision in the back of the eye, and other gliomas of the central nervous system or brain. Gastrointestinal stromal tumors, which are soft tissue sarcomas that can occur within the gastrointestinal tract in persons with NF1. There are rhabdomyosarcomas, which are soft tissue tumors of the muscle. Pheochromocytoma, which are tumors of the adrenal gland. Juvenile myelomonocytic leukemia, which is a rare type of cancer that can affect the blood and bone marrow in infants and young children with NF1. And finally, breast cancer as well. And several, not all, but several of these are going to be covered in later sessions on NF1, both in the brain and in the adult session later this afternoon.